So, welcome to one more session of a YouTube and Insta Live. And you must have got that reminder or that one of the flyers for Google Meet. We are again starting a Google Meet and register yourself to understand how to enter a case, how to take a rubric, and how to understand mater medica and understanding mater medica in a different perspective so that clinically you are able to understand the remedy and able to apply that remedy in your clinical practice. Now that is very important because of course symptomatically nobody can mug up the whole mater medica. It is basically depends on how you understand the remedy. So if you understand the remedy properly, it automatically will help you in your practice and give you good results. So I've just sent a flyer and we'll put that on Facebook and other social media. So register yourself. We'll take 4 sessions next month, and if that works well and if people are happy, we can continue for a long period with cases and mater medica. You'll get the flyers. So welcome Dr. Ruhi, Dr. Shweta, Meera. Good afternoon. Hello Dr. Babel. So as you go further in a YouTube live, first of all, thanks for a lot of questions in 1 week. I think you have asked me a lot of questions regarding fever, and in fever I've always told you. And first of all, thank you for at least having faith in that whatever I am telling you, you are getting good results in your practice. And I hope you share your results so that we all learn. And I also feel that whatever I have taught you is helping in your practice. Yeah, Dr. Shadab, Dr. Babel. So there were a lot of queries about fever. No, these type of fevers. There was a lot of viral still going on, but it is coming down now. And there were a lot of complaints of dengue fever and platelets count coming down, the TLC coming down, fever, different modalities. On report, everything was normal. Still, the patient had fever, and so that's why we worked up a lot of cases, and we had a lot of results, good results with, in fact, dengue fever also. I had a chance of treating a very interesting case of a malignant dengue fever that he was bleeding from the mouth, from the nose and all, and we cured that case. And it was a wonderful experience. I always say that you must also be lucky to get those type of cases in your life. I was lucky to have that case in my life, and we cured that case. Dr. Indranil, welcome. Dr. Razik, welcome. Dr. Shadab, Dr. Ahmed. So there are a few questions where the patient came and told me that in these type of fevers, we are getting fevers where the patient has fevers in the morning, then it is normal, then the evening it comes, then the night comes, then something else and all. So fever keeps fluctuating, and what medicines to give. See, it is not always that you only treat symptoms of fever and you take only symptoms of fever in your practice. Understand the fever modalities, understand what happens during fever. It is not that the patient will have no symptoms, no PQRS symptom, or no prescribing symptom in a given condition. The patient will always have a prescribing symptom or prescribing condition. In that, you have to be able to understand and what you call take out that symptom for prescription. For example, if the patient really comes with fever fluctuation, sometime morning, sometime night, it is so changeable. And whenever the word changeable comes, we always think about one remedy, and that is pulsatilla. If you look at a mater medica, if you look at the mater medica or the repertory, there is a rubric. There is a beautiful rubric, in case of fever, in the chapter fever oscillating. And when you have that oscillating type of fever, the fever keeps oscillating from normal to abnormal. You will be surprised. We have remedies like zincum, metallicum, and pyrogen also. I had a very interesting. Of course, we have China Ars and Chelidonium also, but zincum, metallicum, and pyrogen also is there. And I had a very interesting case, when the patient had that oscillating type of fever, and the patient had a history of amoebic liver abscess, which he was treated with allopathic medicines, and he was feeling much better. In that case, I prescribed the remedy pyrogen, and that cured the case. In fact, amoebic liver abscess also was taken care of, and the fever was also better. So it was a possibility that the liver abscess was not totally resolved, and the patient maybe had that residual symptom of that liver abscess, and he was getting this type of fever. So it is very important to understand that the fever modality, and ask the patient what is there in the fever, whether the fever is with chill, whether the fever is with pain, whether the fever is without pain. For example, whenever the fever comes without pain, there is no pain, with fever, you can think about remedies like phosphoric acid or phosphorus, समटाइम्स द फीवर इज ऑलवेज विथ पेन. पेशेंट बोलता डॉक्टर साहब मेरे को बहुत बुखार है, बहुत हाथ पैर धो रहा है. You can think about Rustox, think about Bryonia, think about Jupiter perforatum. So it's very important to understand the modality in fever. Where what is the thirst during fever? How is he thirsty? Is he thirstless? Or is he sipping water? Does he like the fan? Does he does not like the fan? Is he chilly or hot during fever? Or what does he do during fever? He's very clinging. He always holds the mother. As such, if there is no fever, he's very happy playing. But in fever, he always wants the mother, always wants somebody with him. So these type of symptoms are very important in understanding the case and then prescribe the remedy. Don't always prescribe, eupatorium perf, arsenic, belladonna, and all. Just ask the modality so that you cure in the first dose of your medicines. So welcome, doctors, Dr. Borkar. Yeah, there's one question from Dr. Yeah, welcome, Dr. Bhumika. Style left eyelid. I'll just tell you the answer. Style. See, again, I tell you that whenever you have case, the style. If you open the Mater Medica, there are so many, what do you call, remedies for that. And if you prescribe those type of remedies only with the sides, then you can always fail. So how is the style? It is recurring, not recurring, it is painful, it is hard, it is how hard it is. There are a lot of other symptoms that you have to take care of. So whenever you have style, you can see, this is the world of social media. Just open the repertory, just open one of the program, you can a lot of remedy for style. But I'll tell you only the remedies which I have found useful in style, especially left. The first remedy that you should think about is not pulsatilla, not stephysagria. Think about brattacarp, think about hypericum, think about calcarea floor, and right side, think about nitramure. So these are the, of course, in style, then you can have pulsatilla, lycopodium, sulfur, stephysagria, conium, sepia, silicia, a lot of remedies. Understand that also, so that it's important to differentiate the case also. No, I'm very happy to share that I had few cases of gallstones. Hypocholestemia was under treatment with us. Few days ago, they had done test and USG report normal. Very nice, very good, Dr. Mira. And thank you for sharing your case. In fact, just today, just 1 hour before, I had a case of gallstone which was cured. So I've taken that video. I've just taken a short video. No, these days patients don't give the video because they think that it will be on social media. No, it does not look like. But just today, 1 hour before, the patient has sent a video that gallstones are cured. And if you are following me on Instagram, I'm putting some cases, of cured, a 1 minute video of cured by buffering the face. So I'll put this video also. The gallstones are cured. I've also put some cases of renal failures which I have cured, not treated, cured with homeopathy medicine. I'll put the reports and few reports. So do follow me on Instagram and YouTube. So I'll share some cases also. All softwares, Dr. Bhumika, are good. All softwares basically covers most of the remedies. The most used software basically is a complete repertory. Basically, I follow complete repertory. You can use those complete repertory wherever it is there. It basically covers all the rubrics and all. Short repertory wise, I use Fatex repertory. That's also good. But sometimes, there are some rubrics, there are some conditions where I use Fatex, some conditions where I use Boric, some conditions which I use what you call NER repertory also. But most of the time, a complete repertory should suffice for all your cases now. Okay, and I hope you must have got my flyer of Google Meet. A lot of inquiries, lot of queries over there, that when are we starting Google Meet and when are we starting that webinars, because last year I took 3 or 4. So I've again started, and thanks to my assistant doctors who are with me, and they are also very happy, so that we start a Google Meet. I have a lot of assistant doctors who are with me, so they have tried to convince me to start that Google Meet. So I will be starting a Google Meet, I think next month, every Thursday, 3 or 4 p.m., 1 hour, 1 hour. I'll share some cases and share some insights of remedies which I have found very useful in my practice, and my understanding how to deal with a case, how to take out the rubric, and how to get to a repertory chart, 3 4 remedies, and then how do we prescribe the remedies. That's what we're doing. So if you have not got the flyer of that, you will put on other social media so that you can get the flyers. And I want no complaint that, sir, we did not know. Okay, I'm telling you now also. Next month we are starting every Thursday. Amisha, good afternoon. Kindly share the pointers you look into fevers. Sir, see, Dr. Purva, fevers may, I have no periodized mind that I know only this, I look only that in fevers. When I was studying in the first year, and we came across the rubric aphorism number 6, unprejudiced observer. That has made a very what you call impact in my mind. So whenever a case comes to me, just be open, but always make sure that whenever a case comes to you, the case will have some prescribing symptom. It is never possible that the case would not have. In fevers, in whatever experience I have since 25 years, look about the modality, look about the quality and the quality of fever, look about the behavior of the child during fever, the changed part in fever, and that would guide you to the remedy. Okay, I'll discuss these in my webinar in Google Meet I am taking, so you can always join, and we'll share. I'll there also I'll be sharing some case of fever also. Regularly the testimonials of patients. Yeah. So Dr. Meera, nice. Do keep watching the testimonials, because nowadays a lot of patients do not want to give the testimonials. Those who give, we share it with the buffered face. Dr. Indranil, sir, some patients directly get acute cough and wheezing and constant dry cough. Which remedy should think? Dr. Babel, Google Meet would be in Hindi, because Hindi and English mix, so because we have a lot of Hindi, we do it for the crowd, most of them Hindi, but of course Hindi, English, both will try to accommodate. See, whenever the patient comes with direct cough and sneezing, Dr. Indranil, so that is because on the background there is a psychotic miasm. Ask the patient whether he was a case of recurrent tonsillitis, recurrent upper respiratory infection, asthma in the family, asthma of the patient. That's why when you're exposed to a challenging environment, instead of just getting rhinitis, he directly gets the symptoms of the chest. That's because of his low immunity, or because of the miasmatic background, because of that. So it's a miasmatic problem. Good afternoon, Dr. Vishaka. Excessive abdominal fluid, please reply how to manage this case. See, excessive abdominal fluid, first you have to see why. Whether the patient is suffering from cirrhosis of liver, whether the patient is suffering from some primary disorder, liver disorder, cancer. In this case, you have ascites. So just for ascites, you can have lot of remedies. Depending on how is the fluid, where is the fluid more, on the flanks, on the abdomen. When does it get more, in the morning, evening, night? How is the abdominal, the girth, the texture, hard, soft, painful? A lot of modalities are there. Of course, you could think about remedies like chelidonium. You can think about L-serum, you can think about phosphorus, you can think about kali carb, you can think about natramur, you can think about nitric acid. These are the lot of remedies, Leptendra, Cardosmar, a lot of remedies. Depends on how the symptoms, doctor. So symptoms are very important, Welcome, Dr. Heat. I can give the name. Alexandra, so how can we register? Yeah, you can register. We'll send you that flyer, and let's see how does it go. Okay, but it would be more of Hindi, because English, I'll try to have both Hindi and English. I hope you understand that. Dr. Babal, yeah, the same thing. So as we go further, but as such, Dr. Alexander, I think if you are visiting India, so you can have all the access to the patients, what I see and how I see the case. So if you plan to come to India, as you were thinking about, you can enjoy the cases there also. Dr. Anshul, yeah, welcome. So I hope you understood something about sty. Just one case I would like to just be very fast. I had a case where the patient had sty, and the eyeballs, the patient used to say that my eyeballs become very stiff. It is very difficult for me to move the eyeball, and that was a very interesting symptom associated with these complaints. That's sty. And whenever I of course gave the patient a dose of natramur, and on reading the Mater Medica, I found in natramur there is stiffness of the eyeball. I only prescribed through the case and the sty, but when I was reading natramur, I found that natramur also covers that stiffness of the eyeball. That's what I'm telling you. Whenever the patient present you with some of the is coming in your clinic, there has to be some prescribing symptom which will guide you to the remedy. So keep your eyes open, keep your sixth sense open, and try to see what the body is trying to tell you. Okay, piles growth, cauliflower with bleeding. Yeah, cauliflower you can definitely think about. You can think about thuja, you can think about sabina, you can think about allosocretina, you can think about nitric acid, lot of remedies. With bleeding, I think thuja, sabina and allosocretina would help in your case. Right-sided maxillary sinus chili patient after exposure to wind. Think about rustox, think about arsenic, think about sister scan. Which remedies come to your mind for a little baby that whenever he is not well, he whines and thrashes himself about, throws himself on the floor and sofa? This is basically anger tantrums, first of all. And the try if the child is trying to injure himself, then you have to take the rubric reproaches self. That's important. Albumin plus my serum creatine 5.4, though treatment is going on, will it be completely cured? Deepak Dubey sir, patient class of liver disorders and how to, okay, sorry, completely cured. Ayushi Punjabi. First of all, creatine 5.4, albumin plus. Make sure that you take a very in detail case taking. Kidney failure. I have cases which I have cured it. I have cases which I have not cured it. I have cases which are there for years and the creatine is what you call stable. In fact, if you have seen my Instagram or YouTube live post, I have just posted a case of renal failure where the creatine came to normal. But I have a lot of cases where the creatine is not normal. It is between 2 to 4 and the patient is taking treatment from me for the last 5 to 6 years and they are absolutely normal. So it depends on your case taking and what remedy are you prescribing. Just a question on Insta, I'll complete. Again, my son is suffering from high fever since yesterday, but this time I haven't scolded him. I have given Gelsimim 200, dull, drowsy, but clinging, thirsty, sore throat, desires for juices. Okay, very nice, Dr. Meera, and good to hear that you have not scolded your child. But in this case, high grade fever, high grade fever, suddenly one day, Gelsimim, you can, don't think of Gelsimim on the first thing. Dull, dizzy, you can get in case of fevers. You have clinging, thirsty patient. So think about, first of all, aconite first. Second, with fevers, any other symptom, if you don't have, then first is remedy is aconite, second remedy is phosphorus, and third is acid phos. In your case, I feel acid phos is the remedy in your case, because whatever I know you and your family, acid phos should suit your case. Dr. Wasim, welcome. Yes, I was the case. Thank you, Dr. Purva. Albumin, yeah. Sir, please take a class on liver disorder and how to manage it. Okay, in this Google Meet, I will share a case of liver disorder and how did I enter the case. My case taking, if you have seen, my case taking, if you have seen, I think Dr. Alexander and Dr. Babel also know that I have a very simple approach to case taking. A typical do a case, take a good case, take the history, get the miasm right, get the miasmatic symptom right, repetize and give the remedy. So my case taking is absolutely very simple, but definitely results counts. If it's results, it's very important. Recurrent oral cancer, I think it should help, because if it is recurrent, that means the body wants something very precisely, that the constitution needs something. So definitely it can help. And I have a very bad case of cancer of throat. The whole area is totally ulcerated. The ulcers it is coming out in the past 2 years. He just came to me a month back, and he is doing better. The cancer is still there, but the pain, the irritability is much better. My assistants have taken the case and they know the remedy also. Give 2 doses and report tomorrow. Ayushi, as Hoya, Dr. Punjabi, I know homeopathy is always the last hope, because in allopathy the only treatment is just treating the blood pressure or the sugar, or giving soda bicarb tablets, vitamins tablets, and the erythropoietin injection to maintain the hemoglobin. But in homeopathy, definitely, Dr. Punjabi, very detailed case taking is important, because renal failures, of course, if you ask me, also not difficult to treat, but definitely it can be controlled. I could say that on prima facie. Yeah, so I think a bit fast on my answers, because there were a lot of questions. So if you have no questions, we can always go further and have some other cases. Yeah, there is a question, Dr. Kaushik. Welcome. gallium heparin or remedy for oral cancer. There is a remedy. Gallium heparin is there for oral cancer, and uh, I have never gone to a specific for cancer. Previously, maybe 10-15 years back, I used to think about remedy. Like for instance, I had a case of cancer tongue where sempervivum tinctorium was very interesting remedy. Cancer of esophagus, so cajupotam I used to give. But now I am basically on why did the cancer occur and what is the psychosomatic below that, behind that, and how is the cancer being represented in front of you. That is very important. If I may tell you that case of oral cancer where the whole gum, the whole cheek was involved and the patient was in a very bad state. If you see that photograph also, you'll get scared. It was so bad, but he's improving. So sometimes, if you can improve the quality of life of the patient, because there are so many pressure symptoms, there's a lot of pain, the patient cannot eat, the patient cannot talk because of a lot of pain. And that's why the quality of life, if you can improve in patient, very good. So gallium heparin is there for cancer, but symptomatic will be more beneficial. Where do you live and who are you? You can see my WhatsApp profile and YouTube videos, and you can always get the answer. Okay. So so now we can go further, and just going further in those cases where there are cases where where the head is always drawn backwards. If Dr. Alexandra had a case, drawn backwards. Normally, if it is in convulsions, you can think about Naxomica or opium or ignitia or Artemis vulgaris. But sometimes, I had a case where the patient had a habit of getting the head backwards. Always the head was going drawn backwards. And surprisingly, which remedy worked? Sina worked in that case. So in homeopathy, this symptomatology is very important. I have found that whatever the patient is in front of you, however the patient is presenting in front of you, his presentation, whether is what clothes he is wearing, how he is behaving, how he is talking, how is the skin, how is the voice, how is the face, everything is trying to tell you something of the remedy. So try to catch the patient through different angles, whatever you are practicing, but try to get the symptom, because the body is trying to tell you something, and you have to decode that thing from the patient on by either asking symptoms through miasm or anything. You have to code that. Okay, so that is very important. I hope, Dr. Alexandra, you got something, and whenever you feel that the answers are right and you are enjoying, just give me some thumbs up so that I know that everybody's enjoying. Otherwise I feel I'm talking to only the screen, and because in this, no, I cannot say anybody. It's offline is always uh, good, because you can see the crowd how they are behaving and all this. Offline, I don't know what is happening inside. So if you feel that it is good, just give me thumbs up so I know that we're on the right track. Vaibhav Raut, yeah, welcome. We start at 3 o'clock, Dr. Vaibhav, so if you can join in at 3, it will be nice. Yes, few questions on Instagram. Constitution, different types. Yeah, so there are different type of constitution. Rather than going into those type of constitutions where the Gravels hydrogenous constitution or leucophlegmatic constitution, this type of, just first of all understand how is the constitution, how is the patient presenting in front of you. It's very easy, that what is the body trying to tell you. If you understand that, automatically you can get inside, and you can get. And of course, I always tell that, sorry, I always tell the aura is very important. No, in aura means that when the patient sits in front of you, you sometimes, because of experience, you understand what is happening. What do you expect from the patient? Like for instance, if some lecturer is coming in and teaching in front of you, you get the aura. Okay, how is the lecturer? Is he good? Is he timid? He mild? You get some, you get some vibes. It is said that. So for me, aura is very important. Important whenever the patient comes and sits in front of you, he always carries the aura. And if you can get the aura of the patient and then the symptomatology, it is very, because those are non-verbal communication. You have to feel that. Once you feel that, automatically the remedy works. It's like that. So I know feeling the aura is sometimes sounds very hypothetical sometimes, but whatever students who are with me, I've explained them and they are also benefiting with that. So it's improving. It's very interesting to get the aura of the patient also, so you get the aura of the remedy also. That's important. So send request to be on live video. Okay, Dr. Abba, welcome. Yeah, thank you, Dr. Alexandra. Yes, any other question, or we have scrolled something up? If some questions have been scrolled up on Instagram, I hope people, you can again ask me the question. So if I get some, if I get time, I'll put that. Yeah, we just cured a case of infertility. That patient had azoospermia. With the medicine, the sperm count increased, and now the patient has delivered a baby also. And that's also interesting case. I think one of my assistant have taken that video. So if you get time, we'll put that video on Instagram or YouTube, and you can enjoy that. Okay, sir, venous malformation in the scalp. Shadab Tutija. Yeah, so whenever there is venous malformation in the scalp, first of all, you have to understand whether the patient is in the curative stage, or we can only treat that painful condition in the malformation. Because if there is a malformation, you can't undo that. No, so make sure that you treat the case, you give the relief to the patient, and there is no other secondary symptom because of that. No ulceration happens, the pain is minimized, and the patient lives a normal life with that malformation. Because if it is anatomically a problem, and you can't reverse that sometimes. Okay, you can ask me questions very fast, so I can also answer very fast. Otherwise, I can always have. Now there was a case where if you have no questions, I can just answer my case. Yeah, so there was a case where the patient, I'll tell the rubric directly. Whenever there is discords between the chief and the subordinates, and because of that the symptom happens. Of course, there are a lot of remedies, but I just write down 3 remedies which have got very, very good results when using the remedies. First is Lycopodium, second is Natrum, and third is Nux vomica. I have a lot of cases where I have found that whenever there is a discord between the chief and the subordinate, because the rubric is there, so you don't have to want it in the Mater Medica, just go to the rubric and see 3 remedies I have found very, very useful in my practice: Lycopodium, Natrum, and Nux vomica. We just cured a case of asthma with Lycopodium with these symptoms. So I'm just telling you the clinical symptoms that yeah, thank you, Dr. Poraview. I hope I have pronounced you very clearly. Okay. Yeah, so I hope that is very clear. And as it was 200, Dr. Meera gave the child. And today is, we call Amavasya hai aaj. It's a new moon day. It's a new moon day. And those patients who have moon aggravation, a full moon and new moon, so a lot of cases would come to in your practice and doing very fine up till now. But today he says all the complaints increased. Don't change your remedy. Wait, because it is a moon phase. Okay, it's a moon phase. Don't change the remedy. It will pass off. And if the patient, you have not got the remedy right, and suddenly a patient comes to you, all symptoms have increased, and that means the patient has moon aggravation, or other than you of full moon. So you have one more point to enter the case, the moon phases. So today is that Amavasya day, and it's a big Amavasya. So all the patients of moon phases would have aggravation in these cases, So make sure that you always also take this into account in practice and do it. Okay. Yeah, calf. He's telling the calf only, the malformation in the scalp. I know that. What can be the remedy for dry spasmodic cough? इंद्रनील जी, जब भी हमको ड्राई कफ दिमाग में आता है, जब भी कफ ड्राई रहता है, स्पास्मोडिक रहता है, बहुत सारे रेमेडीज है, देयर आर सो मेनी रेमेडीज फॉर ड्राई एंड स्पास्मोडिक कफ. बट इसके अलावा भी इसके अलावा भी हम देखते हैं इंद्रनील जी, सिम्टम बहुत इंपॉर्टेंट है जानना कि कफ कैसा है, कफ के साथ में उल्टी आ रही है, नहीं आ रही है, तो ये भी हमको देखना है. बट अभी आपने सवाल पूछा तो आप लिख लीजिए. ड्राई स्पास्मोडिक कफ के लिए मैं मेरे एक्सपीरियंस बताऊंगा कि कौन सा रेमेडी मैं यूज करता हूँ. रेमेडीज तो बहुत सारी है. फर्स्ट आप देखिए पल्सेटिला, सेकंड देखिए हायोसाइमस, थर्ड देखिए कोरालियम रूब्रम, फोर्थ देखिए स्पॉन्जिया, ड्रोसेरा, रूमेक्स, एंड वन मोर रेमेडी विच आई हैव सीन विच वर्क्स वेरी वेल, क्यूपरम मेटालिकम. ये 7-8, ऑफकोर्स फिर चाइना भी है और सिपिया भी है और थूजा भी, वेराइटर में बहुत रेमेडीज है. बट ये 7-8 रेमेडीज आपको बहुत काम में आएंगे प्रैक्टिस में. थोड़ी मोडालिटी देखिए, कफ कब होता है, कैसा आराम पड़ता है, तो आपको रेमेडी मिल जाएंगी. ओके, thank you. Yeah, so I think all questions answered. I was about to ask the case of infant, only 34 years old lady, doctor by profession, all reports are normal. She still did all the tests, her husband's reports are normal. Okay. Yeah, that's interesting, Dr. Meera, and see, it's a very emotional attachment when you are treating that case, because once the child is delivered, the patient remembers you for life, and there is a constitutional problem in both the cases, because in this case, because everything is normal, still the patient is not conceiving. So homeopathy has a very important role. I am very sure, take a good case and the patient will conceive. Flora Mende, welcome. But can be an amelioration to number to no. I didn't get the question, Dr. Alexander. If you can repeat that. So okay, so I think it's already half an hour up, and we are through with the session. Interesting session today. A lot of questions, very fast questions. I hope I could answer some of the questions very well. And next time when you have that results, what I've answered, do share your experience so that we all can learn. So I hope everybody enjoyed as much as I enjoyed sharing my experience and knowledge with you. Thank you so much. Until next Saturday, bye.